Now we start with the COVID-19 situation in South Korea. The country has been rolling out its gradual return to normal scheme, and we've seen life come back to businesses, and also the streets are more full with people.
Yes, but we've also seen the number of deaths and those in a critical condition spike in the past few weeks. To that, health authorities ask that everyone strictly abide by virus prevention measures, such as wearing masks, so that the country can continue easing restrictions on private gatherings and business operations.
To bring us the latest, we have our Shin Ye-eun in the studio for us. Good morning, Yeun.
Good morning.
Now, Yeun, let's start with the number of new infections we're expecting for today.
We're actually expecting this number to stay around the 1700s. Up until 9 p.m. yesterday, 1,536 were confirmed. But what's worth noting even more is the number of critically ill patients and deaths. Just last week, the daily average for those in a critical condition jumped by 8.8% compared to the week before, and the number of deaths also jumped by 32.5% in a week.
So what we're seeing is more people critically ill and more deaths. Did the authorities expect this rise, and perhaps more importantly, were they prepared for it?
As a matter of fact, they did expect to see this rise, and they added that their current medical capability was well prepared. So take a listen.
Though we've seen the number of critically ill patients and especially deaths go up the past week, we currently have the medical capability to bring this number down. Nearly half of all our hospital beds are empty. To further strengthen each region's medical response, we're finding ways to activate treatment from home.
But the authorities caution that everyone needs to work on bringing this number down.
If virus prevention measures aren't strictly kept, we might experience a resurgence in cases like some other countries that have attempted COVID-19 exit strategies. In order for us to safely transition to normal life, everyone needs to participate.
Well, Yeun, speaking of countries that attempted COVID-19 exit strategies but have seen a resurgence in cases, I heard that Germany has the highest level of COVID-19 infection rates since the pandemic first began. Can you tell us more on that?
Right, so Germany is seeing a resurgence, and to give you some numbers, Germany on Monday reported 15,513 new infections and 33 deaths. In total, Germany has more than 4.7 million infections and 96,000 deaths. Now, Germany's 7-day infection rate, which is basically the number of people per 100,000 to have been infected over a week, rose to 201.1 as of Monday. This was higher than its previous peak of 197.6 last December. And health authorities say if infections continue to spread at this pace, the number of critically ill patients will double from now. Germany currently has more than 2,500 patients being treated in hospital, which is similar to its record from last winter. And they added nearly 90% of all new patients are unvaccinated.
Right, and the vast majority of medical experts do suggest people get vaccinated where possible, if their doctor recommends them to do so. From next year, we're also going to be seeing these antiviral pills come out. We know that South Korea has put orders in for some batches and should get them earlier next year. But what about other countries?
Right, so yesterday we talked about how the hottest pills in town right now are those made from Pfizer and Merck, and they're called Paxlovid and Molnupiravir. I also mentioned how South Korea is set on securing deals with relevant companies. One update is the country will start distributing more than 4,000 courses of the treatment from next February. Meanwhile, some 90 countries around the world are in active discussions regarding buying the antiviral pills. The UK became the first country to approve Merck's Molnupiravir last week, and the U.S. said it already secured millions of courses worth of the Paxlovid treatment from pharmaceutical company Pfizer, as Pfizer is set on submitting successful clinical trial results to the FDA and waiting for approval. Some firms in China have also expressed an interest in producing experimental COVID-19 drugs developed by Merck under a global program to distribute to developing countries. And we're still waiting to see what Israel will do.
All right, let's hope these pills could help us get back to normal life. Now, thank you for your report, Yeun. We'll talk to you again tomorrow.
Thank you.